The last week of April is World Immunization Week. The initiative aims to promote the use of vaccines to protect people of all ages against disease. Immunization saves millions of lives every year and is widely recognized as one of the most successful and cost-effective health interventions. Well, to talk more to us about this, we find out about how the Health Department will be driving this campaign is the Chief Director of the Department's Child, Adolescent and School Health Program, Dr. Nonhlanhla Dlamini. Doctor, good morning. Thank you very much for coming in.
Good morning.
I understand that the World Immunization Week is the last week of April.
Yes.
Today is the 29th, which means tomorrow it's wrapping up.
Yes.
How has it been going so far in our country?
All right. We are using this opportunity to inform our population that the Department of Health will be conducting an immunization coverage survey, because we want to know in South Africa how many children are actually fully vaccinated. Do they get all the immunizations that they are meant to get? And if not, why not? Are there children who are getting some of the immunizations? And are there some children that don't get any at all? And then we're going to use this information to actually improve services so that we'll know the reasons why this isn't happening.
Is the survey underway currently?
Yes, it has actually started, and we're going to cover over 1.1 million households in all districts of South Africa. So if what I'm appealing to our household is that if your household is chosen for our interviewers to come to your house, please allow them to come in, and the questions will take about 20 to 30 minutes, and then that information will really help us improve services.
Why does the department believe it's important to do this survey, really? Because every year we know there's immunization campaign. Just the other day, separate from the immunization of children, we're talking about flu vaccines, for example.
Correct, yeah.
And last week we also spoke about the vaccine against malaria, as an example. The children in Malawi are the first in our region to be vaccinated against malaria. So it looks like vaccination is very important.
Yes.
But why do you believe that you must do the survey?
Well, we want every child to actually receive the vaccines. So they are offered for free in our health services. So we want to know what would make a parent or a caregiver not have access to these vaccines. And the other thing that the week reminds us is that no parent, no family should go through the anguish or the despair of having a sick child in hospital, because these diseases that vaccines prevent can either kill the child or the child gets extremely ill. And that time when the child is admitted, the parent or the household is going through this intense anxiety and anguish, because they don't know what's going to happen to this child.
And in most cases, if you did immunize your child, you're protecting them their life. So those diseases they shouldn't be getting.
They shouldn't be getting
What
them.
kind of illnesses, diseases are we vaccinating against currently?
It's the killer diseases. So the first one that the child gets, newly born, is BCG, which protects against TB. So we know that there's so much TB in our country, and TB also kills. And then we also protect against polio. Now, the people shouldn't have this false sense of security that polio is gone. Just because you've never seen a case of polio, you think your child is safe. There is polio in the world. And even if it's not in South Africa, it can be imported. So we really have to keep our children safe. And then, and even the way the vaccines are administered, it's either drops or an injection. It really isn't something that's so terrible for the child or for the parent in that case, because some parents get very distressed.
And we still vaccinate against measles and stuff like that.
In fact, measles is the one that's very topical right now, because the reports that's come out from the World Health Organization on the close of the vaccination week is that this year we have more measles cases in the world than we had this time last year. And measles is a killer. And measles also causes severe disability. It's one of the commonest causes of blindness.
So I guess we need to understand why you're doing the survey, because that tells me if in the world there's more measles today than last year, at this time there's a concern that people are not vaccinating children.
That's correct.
So you really have to get to the bottom of why.
Why, yes, exactly, and solve the problem. So the problems could be on the demand side, which is the demand from the household or parents and caregivers, or it can be on the supply side. So we want to know.
Could also be a lack of understanding of the need for this. Thank you very much, Dr. Dlamini. We wish you well. That's Dr. Nonhlanhla Dlamini, Chief Director of the National Health Department Child, Adolescent and School Health Program, talking to us about the importance of vaccination and the current survey that the department is busy with. It's going to be interesting to see what they find. We'll have to talk to them later on once the results are out.